to the anti-penultimate session of Next. Arthur's smiling because he knows I used perplexity for that one. But this, I believe, is a bit of a cross-examination into medical affairs with the lens of the general manager. So just to set the context, 4 years ago, I was working in the regional office in medical excellence, and there's a lot of rhetoric going on about medical affairs. We've made it. We're the third pillar. We're the leaders. We believe it. We have to be. And there was a lot of mirror talk, and I was like, I'm a little bit skeptical of that. Have we really canvassed everyone? Are we because we say we are? And so I did what most of you guys have done, right, in marketing, even though I was in medical. I reached out to people, did a market survey. Most of you guys answered, and we had a survey of about 20 business unit directors and managing directors give their perspective on medical affairs. So that was 4 years ago. 2 years ago, I do what I normally do, and I partnered up with people smarter than myself. Most of them are in this room. And we helped to write a paper about that. I'm really pleased to say that 3 of these authors, these smart people, are with us here today. So welcome. We've got Josie, we've got Nat, and we've got David. And ultimately, what I want you guys to take away with is to get an answering on 3 different questions, which is, number 1, what is the current state of medical affairs right now and its future? What could we do better, and what are we doing quite well now? And if we get time, we'll have some spicy questions. When my daughter drinks spicy water, she's gets a little bit peppery, so we have a bit of time for that. So to kick things off, I'm going to ask the audience, and hopefully this will work with Slido. So on a scale of 1 to 10, what extent is medical affairs considered a co-leader in your company? So 1 being a support function, and 10 being strategic co-leader. And as we play that elevator music, maybe I'll throw it to Josie. Your thoughts. Be ruthless.
I'm going to say 10. I think today medical is a very important co-leader and a strategic partner in strategy. And I actually wanted to talk about what's happened actually with the evolution of medical affairs. So if I think about, I've been around for a long time, but if I think about the early days, we didn't have that many people in medical or medical affairs, and so they started in compliance, promo review. They're kind of the police as well. So that they often, I would hear complaints from people saying, medical says I can't do this, medical says I can't do that. That evolved into more of starting to see a partnership. And but there was still a lot of argy-bargy between commercial and medical. And you've probably many people have heard the saying sales prevention unit. So, I think the teams were trying to work out how to work together. And so medical was really trying to work out what value do I provide? And the organisations and even GMs were trying to also work out, well, what is the value of medical? But we did see a number of medical people increase over time. And I've worked with some amazing medical leaders and had great working relationships where I really saw them as true partners. And we're now at a point, and I certainly believe in my organisation, where the medical leadership in my organisation is absolutely fundamental to our strategic development and implementation.
I love it. I love the SPU as well. Nat, your thoughts?
I'm a 10 as well, so we're not controversial at all yet. I'm still coming off the back of Adrian's presentation, and I just want to highlight that the 3 of us were on this side of the room. That I think it's worth stating. But for me, it's a clear 10. And in fact, going to Bernd's presentation, when you looked at the soccer field, we saw medical across the field. The defence, the attack, the centre, and actually for me, I loved that presentation because it really highlights the evolution of the function over the last decade or so.
The whole left wing, I love it. David, your thoughts?
John, I'd probably say to really be effective and truly patient-centric, you need to be at least 8 and above. Okay? And if you're not, and you're in the medical affairs function, I think you've got to ask yourself, well, why not? And I think to pick up what Josie was saying, and I also entered the industry many years ago, and when I think back on the medical affairs function then, they're almost like in the wings of the stage. Like they appeared, and then they did a couple of things, and then they almost disappeared again. But then also think about the context and the ecosystem that we're operating in. And I'm going back to kind of like the cardiovascular wars and the lipid wars, where we just had these marching armies of commercial people. And so I think the environment actually probably didn't allow for medical affairs to be this leader. However, and fortunately, and I say this really fortunately, we've evolved as an industry. And so I go back to the point, if you're probably not rating yourself 8 and above, go have that conversation with your team, with your group. Ask yourselves why not, and then what are we going to do to get there?
Yeah, 100%. I think, we have historically been on the sidelines and we were comfortable there, but we've definitely picked up that proactiveness, right? And we're right on defense, midfield, strikers, and it's so encouraging to see. What's also encouraging to see is in MAPA, about a month ago, what I understood was that we self-reported, we medical affairs, as 5 or 6. It's so interesting to see that the outside perspective is far beyond that, and maybe we'll talk about that a little bit later on in the discussion. So already I think it's 7.1. So just to kick on a few more things that we talked about, so throughout the years, and maybe I'll go reverse order, David, maybe just take us through some of the historical, the background, the trends around medical affairs. I know, Josie, you already touched on that, but David, what's your thought on how we've come and some of the trends that have manifested our position?
Yeah, so John, this is actually a diagram that was in our publication, and I think I've touched on, when you're the more like almost the servant or somebody in the wings, which fortunately is in the previous years. But how I think it's evolved is to more of a partnership, and I think once again the broader ecosystem facilitated that partnership. However, as we evolve in the complexity of our therapies and the personalization of medicines, I think it's imperative that all of us embrace medical affairs. If you're in the commercial side of the business or regulatory side, any of the other functions, it's to actually embrace your medical colleagues as strategic leaders. And my observation is quite interesting. I think Adrian also touched on this earlier, is that on the occasion, I think we lose sight that we're actually all in the same company, and ultimately we're all actually trying to get the same outcome, which is to provide the most optimal medicine that patient would require at the same time. And so I look forward to the days where we're still in this teal color, or probably teal would be the best description, because I think that is the most productive environment and the most productive place where we should all be.
Yeah, absolutely agree. So kicking on to a little bit warmer discussions. So I think, Nat, what do you value most from medical affairs? What are we doing good at? What really, interests or piques your curiosity when we start to do things?
So I have a terrific medical team at Abbvie, just saying. And actually, they challenge me a lot. So if I answer that instinctively, it's the challenge. And the way that we are trying to instill different ways of thinking, I see a lot of that coming from the medical team. And across the board, not just medical affairs, but the broader medical function. And I absolutely love it. So for me, that point on being a true strategic partner is about the challenge. But it's also that they sometimes are the voice of the patient when we haven't had that front of mind. So I've seen that rise as well. So I could talk about that for a while, but conscious of time, I'll leave it at that.
Yeah. And Josie, your thoughts about the activities, what sort of piques your interest in terms of the things that we do? Because there's so much that we do, we don't have that bullet, that single bullet.
And I guess it depends on, what level you're at as well in medical affairs, because we have, now there's quite a well-defined career pathway for medical affairs professionals. But one of the things that I'm seeing more and more is this co-development of strategy. I think that's absolutely crucial. They provide, medical affairs provides really, really valuable insights which help shape strategies. Our focus is on best patient outcomes. So how do we ensure that we drive best patient outcomes? And your comment about, the focus on the patient is really important. Generating data So a lot of people in my medical team are involved in investigator-initiated studies, real-world evidence, review of registries that can provide data that we can put forward for pricing submissions or expanding indications with existing products. They're working more and more with with our market access teams as well. So there are a lot of opportunities to expand their scope and their knowledge across organisations. So the roles are much more diverse, I think, than they were, say, 10 years ago.
Yeah, definitely. It's definitely evolved there. Okay, so I'm going to raise it up a notch. What could we do better? And maybe what pisses you off? It's after 5. It's fair game.
I'm going to...
You can go first.
You're saying it...
Yeah, take it.
Go.
What we had... I'm laughing. We had a session at the office the other day. The program's called What Triggers You Off? So what pisses you off? Same sort of stuff. I think sometimes, and if I can be provocative in the spirit of next, I wonder if our medical colleagues sometimes hold themselves back, their own limiting self-beliefs, if you will. So many times, I mean, the reference to in the wings, I do sometimes still see, and I want their voice loud at the table more. So it doesn't piss me off. It's just an area that I say, let's do more in that space, that invitation to think, you know what, I'm not agreeing at all with what's going on around this discussion, and I need to give the voice of that customer that I was just with last week and bring it into the conversation, or the voice of that patient that hasn't been rightfully expressed in this particular conversation. So I do wonder if there's something to be said about that in your own minds. Like, what's holding you back from pushing the commercial organisation?
Maybe if I can add to that, I'd also say, back yourself across the whole product life cycle as well. Medical affairs isn't there just pre-launch activities. There's actually the whole life cycle. There's actually the whole patient journey. And there is a lot that you could contribute across that whole journey. I think, Josie, to your point, in terms of value and access, yeah, I think that's really almost like an untapped area where medical can truly provide some really potent insights that shape that value and access strategy. And I know from this morning's session, that's probably one of the biggest challenges we're facing as an industry now. So it's just having that confidence, because the capability's there to speak up. I'd always say, rather speak up and be heard than be silent, and then in 6 months later, you're like, oh, but I kind of thought that. Well, the boat sailed,
And just quickly, sorry, go Josie. Yep. Please.
I just want to make a comment as well, because I see variability in my medical affairs team, and those that are really successful and hitting goals and are owning the strategy and taking accountability. So I think one of the things that you also need to be considering is that if you want to own the strategy, if you want to be seen as a leader, you also need to take accountability. And sometimes I see individuals who will make comments, or, they've got the knowledge, but they won't step up because you're putting yourself out there, and you need to take accountability. All of us are I think, if you need to take accountability as you become more senior in an organisation, and if you really want to grow.
Yeah, I agree. So communication, strategy, and proactiveness. Is that right? Yep. I think those are very key points. So just kicking on, so talking about your medical directors, you guys work with great medical directors, right? Awesome people. We've got a few young, aspiring medical affairs people. What message do you have? What mindset, what capabilities could they cultivate to become those really, I guess, curious medical directors that deliver more than just medical affairs?
I'm happy to start. I think one of the words is be curious. When I think about interviewing people, one of the first things that I look for is the mindset and the energy that an individual has, the questions that they ask, the curiosity that they're demonstrating, that learning agility, that positive interaction. So the personal skills are really, really important. So keep working on your interactive skills, whatever that word is. The way you engage with people is really, really important. And that desire to want to learn and grow. That's one thing.
There's a few things. I go back to Adrian's last presentation. It's leadership. Medical director is the title, but it's a leadership role. So there's something about transcending the function and being a leader. So I'd anchor a bit to that. But I would really encourage folks in the medical function to get out of the medical function for a chapter. Just experience something else, anything else. My medical director was a commercial leader for a period of time. David and I know her well. And actually, it gave her such a flavour of the pressure that the commercial organisation feel when they're pulling numbers together and planning their P&Ls and et cetera, et cetera. So I think it's given her the ability to come to the table with that experience that lends credibility to the conversations that she has when she challenges. So maybe as part of your career paths, get out of medical for a bit to head back there if that's your ultimate dream.
Nat, maybe if I can add to that, for me, it's diversity and agility. I'm a massive fan of diversity, particularly in your role, in your career development. And we're fortunate that we're in an environment now where you can take short-term assignments. So if you're in medical, you can do a short-term assignment for 6 months in a commercial role, in a market access role. Likewise, if you're in commercial role, there's nothing stopping you doing a short-term assignment or a project in one of the others. So think of your career development more zigzag to round you out completely versus having this functional depth. Because the shape of our careers now, it's probably more of like this M shape, yeah, where we're getting more experience and diversity of experience. And so that's something I'd probably put a challenge to everyone in this room. How diverse has your career been? And if it isn't, well, then seek out some opportunities, because I'd almost guarantee you'd be well better rounded after that experience. There's almost nothing to lose. There's only a lot to gain.
Yeah, absolutely. I think the zigzag pathway is something I've gravitated towards. In that spirit, slightly controversial, I want you guys to answer this in a 3-2-1 fashion. Do medical directors have to be doctors? 3, 2, 1.
No.
Wow. Tell me why. What's changed? Because 10 years ago, you had to be whiter than white. You had to come from MBBS or MD. And what's changed? And what people have provoked that idea?
And maybe I've been an outlier, but I've never had that view. I think our industry needs medical doctors in the company. So I think we want to have them in our company. But to be the medical director, I think the thinking was there's credibility with that, but I just see it as a leadership role. So first be a leader. And I'd even go so far as to say, what if you put a commercial person to run the medical department? So to me, leadership has to be the first driver. And so for me, it's a strong no. Not to say they can't. If you're a medical doctor and that's your ambition, absolutely, but it shouldn't be a inclusion criteria.
I agree, and if you think about how business has evolved, how our industry has evolved, we were functional experts. We've gone from being functional experts to having to have broad skills across a number of areas, and so that functional expertise, you can AI it, you can bring in the expertise as you need, but that leadership and how you demonstrate leadership is what drives success in an organisation.
Maybe a very quick comment, I think, just to double down on what Adrian said before. If you have aspirations of being a medical director, you really need to want leadership. And I mean that, I'm not making that statement lightly. Leadership is extremely difficult, but it should be difficult, because anything that is challenging is probably worth it. So if you're really aspiring to that medical director, I absolutely agree with that. It is. It's about the leadership skills. It's also about that diversity. You've got to want it. Don't want it for the title, because it will be a very, very challenging period in your life. But do it because you enjoy leading people. You enjoy that responsibility, that accountability, and actually making an impact.
Yeah, fantastic. Last question before you guys play the music, because I can see your eyes burning through mine. opposite side, could a medical affairs person become a GM? And what would it take?
Yes.
Yes, I would say, yeah.
What do we need? Do we need P&L experience? What do you want to see in the resume? Like, what does that look like?
Yeah, definitely P&L experience. I think, and this is why, as you said, Dave, the short-term assignments are really important. But jumping into different roles and getting that breadth of experience across an organisation. So you can't. I think it would be very difficult just to do medical and move up. But I have to say, in my organisation, our CEO came from R&D, and he is brilliant. So we're looking. I think organisations look for leadership and learning agility.
Yeah, I agree. I mean, obviously you have to be able to speak the language, but there are numerous opportunities of that. I think I can even share some examples from quite recently, where the head of medical has actually sat in on the AOP plan forecasting models, partly to observe and learn, and also partly to contribute. And actually, the plan is better rounded out with their contributions. So it's a matter of just, I think, fundamental thing of curiosity once again.
Well, it's been said, we're out of time, and I agree with my colleagues here.
Awesome. We'll leave it at that. Thank you so much. Thank you so much to my head coaches.
Thank you, John.
Thank you.